Anavar on training days. Now, this video is part of my harm reduction series. As always, have to do this, and I always have to initially start off by saying none of this is ever going to be medical advice. This is strict, progressive, educational information because I know where this is going. I know what's happening in the world with men utilizing PEDs. It's happening. It's real. People need to understand it, and we need to be super progressive and provide education. So the first off, the caveat is that Anavar on training days is going to be exclusively for men that are already on testosterone because you're going to get shut down. And of course, let's get some comments. What do you guys think about that? Anavar utilizing it without testosterone so you don't get shut down for limited cycles, limited regimens, alternative regimens like this. Because this is called an alternative regimen where you don't do it every day on training days. It's been out there for a long time, guys, at least 10 years. So I needed to compile a scientific presentation from the real chemistry and the clinical side of what I see. So I'd give warning that if you're a man and you're a teenager or anyone up to 23 or 25 years old, in my opinion, you shouldn't be doing anything that's going to shut down and compromise your natural status. So guys, if you're watching this and you're natty, please stay natty as long as you can for yourself, not for anyone else. Please try to stay natty. Really think about that. And I want to hear comments from you guys, young guys. What are you doing to stay natty? What's going on with this? So beyond that, I have to always open up with that harm reduction. Let's talk about the science of Anavar, Oxandrolone, and the history. 1962, first created by two scientists, Raphael Papo and Christopher Jung, while working at Sara Lee Laboratories, now part of Pfizer. And then 2 years later, it was released as a pharmaceutical drug by the FDA in the United States, 1964, the year I was born. Over the years, I'd like to list the incredible properties and utilization, medical issues that this thing has been used for. Number one, it's going to be the promotion of muscle growth because it's an anabolic steroid, oral anabolic steroid. So it's been utilized since the 1960s for surgical recovery, cancer recovery, cachexia, chronic infections, HIV and AIDS, osteoporosis for women, and the bone pain that can come along with that for women, alcoholic hepatitis. Now listen to this. You think alcoholic hepatitis, it's liver disease, it's an oral anabolic steroid. What's going on with this? Well, it's amazing that this is the only oral 17-alpha alkylated anabolic steroid that is not significantly cleared by the liver. It's cleared by the kidney. And of course, you will see increase in transaminases and potential liver disease when you're on Anavar because the doses medically were 2.5 to 10, maybe 20 milligrams a day. And men are taking this up to 100 milligrams a day. I want to get that apart to you guys. When you look at the data scientifically, then you look at this paradox of, well, the data came up with this, and now what's happening here, it doesn't make sense. Dose dependency. Also used for Turner syndrome in girls. This is typically going to be teenage girls. Obviously, the Turner syndrome chromosomal situation is that normal girls have two X chromosomes, and with Turner syndrome, they're missing one X chromosome fully, or they have a defect in one of the X chromosomes. Next condition, status post long-term corticosteroid utilization. That's going to be prednisone or types of corticosteroids from severe asthma, from lung disease, from rheumatologic disease. I've seen this in young kids, in pediatric and in adults, of course. So it was utilized because when you're on corticosteroids, it's cachexia, it's going to be catabolic. This is an anabolic steroid to counteract that. Again, this is the history, guys. Burns, severe burns, which it's still utilized for. It's so anabolic that it's utilized when you're having severe burns in the ICU. It's utilized. They think about this. Anemia, and of course, because it's an oral anabolic steroid and it has these properties, it's going to affect the red blood cells through the androgen-induced erythrocytotic properties and increased red blood cells. Idiopathic short stature for children. Now that we have human growth hormone, it's not utilized anymore. Timing is everything on this one. They used to use it for children that are not growing. But of course you think, wait a minute, if children take steroids, they're going to fuse the long bows, epiphyseal growth plates, and they're going to keep their stature short. There's so much paradox on here. Timing is everything, but it's not utilized anymore. Also utilized for hereditary angioedema. That is the laundry list of medical issues that it was slated for and still is utilized for. Anavar, Oxandrolone. Now, let's go into the chemistry of this drug, because we have to understand when we're using it, if we're going to be using it, when men use it on training days as a limited profile, what is the chemistry? First off, it's classically DHT-derived, and it's very anabolic compared to baseline standard testosterone, and potentially up to 5 to 6 times more anabolic. And it's significantly less androgenic. That's the secondary male sex characteristics. It comes already chemically 5-alpha reduced, so therefore it's not a substrate for 5-alpha reductase. Therefore, you will theoretically dose-dependently see a lesser effect on skin, hair loss, and prostate. However, because people are using doses, again, up to 10 times the intended medical dose, you're going to see side effects. And it's a paradox, but it's really not a paradox. You're just taking so much of the drug, and again, for so long, that it's going to cause clinical side effects. And there's so much variability. Now, it's cleared in the kidneys, and I said it's the only anabolic steroid that really, oral anabolic steroid, that's cleared through the kidneys versus the classic 17-alpha alkylated oral steroids like Dianabol and Anadrol and others that are going to be significantly hepatotoxic. But again, the doses are key. I've seen over the years men on Anavar, and we look at the labs and we see the transaminases up. And of course, we know they're on Anavar. Typically, again, 40, 60 milligrams, 80, maybe more. They're on it for about 2 weeks. It's starting to kick in, even up to 6 to 8 weeks or longer. You're going to see the effect. With the grace of God, I've never seen strict hepatic failure or hepatic significant side effects in the physiology chronically or long-term, anyone suffering from Anavar itself on the liver. And if you do a research background check, if you really look at this, you won't see any cases of this. But again, when men use anabolic steroids, there's so much polypharmacy, you're blind, you don't know. They're using not just one drug, they're using multiple drugs, so you have to be careful. Again, back to the chemistry, it's not a substrate for aromatase, so it, in theory, is not estrogenic. It has no progestogenic properties. Again, this is a strict oral anabolic, less androgenic steroid. The half-life of the drug is approximately 8 to 10 hours, depending on the person and the chemistry, of course. Steady state concentrations will be reached at about 40 to 50 hours, depending on the dosing regimen. The intended dosing regimen in the United States from the 1960s. Tablets, 2.5 to 10 milligram tablets. The dose was utilized 2.5 up to 20 milligrams a day, divided doses because of the half-life, twice to maybe 3 to 4 times a day. That's the chemistry and the history of Anavar. Let's talk about what is the potential pros versus cons. What is this utilizing Anavar on training days for harm reduction for you guys out there? Obviously, let's talk about if it works. That's the first feature. Again, there's no studies on this, and God, would that be beautiful to really do a proper study on this? This is progressive, and this is going to happen, I assume, sooner or later. Does it work? In my opinion, it works. Obviously, it works. I've had powerlifters, some elite powerlifters, tell me that they don't want to take steroid cycles. These are all going to be men on testosterone as a base. They've already crossed that line already, and they're adding Anavar because they don't want Anadrol or Dianabol. They don't want to do the heavy doses of Anavar every day to suppression and for the side effects. So they'll take maybe 25 milligrams as a pre-workout several times a week, 2 to 3 times a week, maybe the squat day, again, powerlifting guys and strongman guys, maybe the bench day, maybe the day of the leg day of the deadlift or the squat day. And it does work. Let's get comments. This is where I have to have comments. What are your doses? What are your regimens? Are you a pro? Are you amateur? Most of these guys are going to be amateur, but they take it very seriously. I do too. I train hard. I love it. I take it very seriously. What are the mechanisms on that? If you're not taking it every day and you don't reach that steady state, 40 to 50 hours, and then stay on it for weeks, which is obviously going to work, this is a very strong steroid for strength. This is some of the most famous powerlifters in the world have been utilized regimens of just testosterone, Sustanon with Anavar. Of course, big doses, 60, 80, 100 milligrams. And they use it for 2 or 3 months or less. Receptor alteration in the skeletal muscle, the receptors. It's all going to be about stimulation of the receptors. Not to mention the CNS. Men will say they used it 25 milligrams before they work out as they're driving to the gym or at home and they're getting ready and they take their other pre-workouts and they just get amped up. It's just going to be a stimulation of the central nervous system. But again, there's no data for this. And is it going to be a placebo effect? Really? We don't know. How can we know? We have no studies. Common sense has to come into play here. Now, obviously, another very important piece is going to be the lower cumulative exposure of a toxic drug. Any drug, taking drug holidays. We do this with a lot of drugs, like Adderall. The doctor will tell you, if you have ADD, don't take it every day. Take off the weekends. Drug holidays. Give your body a break. Common sense. Now, more comments. What are your side effects, gentlemen? What are your medical issues? Are you on testosterone? Are you on other sundry anabolic steroids, equipoise, so on and forth, Winstrol, Anadrol? What is it like? Growth hormone, insulin? And what have your labs looked like? Let's get right into the meat of this. Have you had medical problems? What do your labs look like? Do you recover on the labs? Is it the red blood cells go up? Your liver enzymes go up? Have you ever, God forbid, had a medical catastrophe complication like a heart attack or a stroke or a blood clot? Obviously, the lower cumulative exposure will allow men to utilize it, and of course women, to utilize it more extensively and for more time. Who wants to stop any regimen after a limited time of 6 weeks or 8 weeks and now you have muscle and you feel great and it's time to stop? And that's why men don't stop. And that's why I'm doing this, to reach out for the harm reduction. So if you're having a lower cumulative exposure and you are less hurt and there is going to be potentially no hurt, or limited hurt. We have to consider this scientifically, ethically. What do we think about this, guys? What do you think? I've seen men utilize this as a pre-workout 1, 2, 3 times a week for years. And obviously, when I look at the labs, depending on the man, depending on so many other circumstances, it's so multifactorial, I see effects. But again, these are my patients, so I'm hammering them from an aggressive standpoint of harm reduction and protection, because that's what I do. Now, the concerns. Obviously, there's going to be concerns. It's a slippery slope. Even if you take it once, twice, or 3 times a week, with or without testosterone, could you get shut down? Is there going to be side effects? It's common sense there's going to be some side effects. Everyone's got a fingerprint. That means everyone's biochemistry is going to be different. Is it worth it to you? Are you taking it with steroids, with other steroids? Dose dependency is going to be so huge, and that's part of the discussion today. When you look at a regimen that it's an alternative regimen, when you don't take it every day, you take it every other day or once a week or 3 times a week, drug holidays, obviously it's going to be less potentially dangerous for someone. There's going to be lower complications. But does it work? And is it worth it? And so many men, I've researched this in the internet, and I've asked so many of my men, is it worth it to even do it? What's the dose and what are you doing it for? And just do a full cycle and take a break and so on and so forth. I want to get the discussion going, guys. And my usual health vigilance to conclude this video of harm reduction, bringing you progressive medical educational information, is going to be reviewing the ABCDs. Hemoglobin A1C obviously is not affected really on this. B is blood pressure, and kidneys absolutely can get affected. But when you're doing it on, off in small doses, do you not get an effect on blood pressure? Let me know. We need some studies on this. It's common sense. If you do it every day and the doses are big, it's going to affect your blood pressure. I see it. C is cholesterol, cardiac calcium score. There's no question that when you're on Anavar, it's going to adversely affect the HDL. It's an independent risk factor for coronary artery disease. And if you have genetics for this, it's multifactorial. These are my ABCDs. So it's going to affect the HDL. But if you're using it in a limited fashion every other day, does it not affect the HDL? Well, I've seen levels and I've seen things all over the world where any utilization, if you use these, even this drug, of course, on testosterone, you're going to see a diminution. You're going to see a decrease in the HDL for, 90-something% of men. There's no data on this. I'm reaching into my brain with thousands of men from my clinical experience for you guys. And D is the dad. Does he have heart disease? Are you looking at heart disease genetically? The ABCDs. And then D is deposition disease. This is the androgen-induced erythrocytosis. You have to watch my videos on this, guys. And if you're utilizing Anavar and you're susceptible to this, and it's every day, it can be outrageous on the red blood cells. I've done consults with women, professional women, and I've seen where they have polycythemia because of Anavar. Again, it was utilized for anemia. It works. But again, the concept of the video, if you're using less doses on, off, giving the body an ability to recover and take a break, is it worth it? Does it cause disease? And the last one on the ABCDs is sex. I could tell you this. Men that utilize Anavar, full-blown cycles, or even living on it for months and even years without coming off, and not this alternative training day regimen. In the beginning, Anavar on top of testosterone, again, will probably increase your sex drive. DHT-derived, central nervous system. There comes a point when your sex drive will be affected adversely. I see it, guys, And then what I have to do is stop the Anavar and work on some other issues, changing the dose of testosterone potentially and helping this man to recover. Hitting the reset button, coming off Anavar completely because you've been on it too long, and now the central nervous system, the limbic brain, is shut down and you're suffering sexually. I see this regularly. That's in part why I'm doing this video. But they're on it full blown, 10, 20 milligrams a day on top of their testosterone. Everything's going to be great in the beginning, but can you live on it regularly every day? In my opinion, no way. That's going to be a problem, sexually and medically. That's it, guys. Please digest this video and understand that I'm always trying to help you guys with progressive medical harm reduction, information, educational purpose only. And I want comments. We have to get the comments because this channel now is a grace of God and it's helping more and more men every single day. Thank you so much, gentlemen. I really hope this helps you guys.